As if COVID-19 wasn't enough, there are now growing concerns the flu season could be much worse this year than last. Why? Partly due to easing public health measures. Also, more people are traveling, right? Our Chase team has reached Dr. Susie Hota in Toronto. She is the Medical Director for Infection Prevention and Control at University Health Network. Dr. Hota, this seems to be an annual conversation for us. I know there were low rates of, the flu last year because most of us were inside. We were really conscious about washing our hands, wearing a mask. How do you think this season will compare?
One of the things you learn when you've been doing infection prevention and control, pretty early on, you understand that you can't predict what flu is going to be like. And this year, like you mentioned, people are socializing a little bit more. We don't have the same level of public health restrictions, but we still have a lot of masking happening in indoor settings. And so depending on how much people come forward to get their influenza vaccines and what kinds of restrictions we continue through the upcoming months, we can see a variety of scenarios play out with influenza this year.
So walk me through some of them. What keeps you up at night?
Yeah. So, obviously the worst case scenario being that we see a large surge of influenza, partly because we didn't really see much of it last year. And, I think we do depend a little bit on some pre-existing immunity to help protect against large surges of influenza year to year. And the virus itself changes, over time. It mutates, it drifts, it shifts quite a bit sometimes. And so we don't really know what that's going to look like. And so the big concern is, especially if a large surge of influenza occurs at the same time that we're still accepting, more COVID-19 patients into the hospital, that can really overburden the system and make it very difficult for people to get the care that they need. So that's worst case scenario.
Yeah.
Somewhere in the middle, we might see, lower levels of influenza coming into hospitals and people getting sick from it than we typically see year to year. And keep in mind that, it's an estimated 12,000 people per year in Canada that are hospitalized because of influenza or related complications, and up to 3,500 people who can die. So, that's a typical year. So if we're a little bit less than that, hopefully we'd be able to cope and manage all the respiratory viruses we have to manage, and people won't get too sick from it. Best case scenario is the masking that we have in place and some of the restrictions and socializations and behaviors that people have had because we're still in a pandemic, as well as reduced travel, might actually protect us from having too much influenza or other respiratory viruses that get people really sick.
You mentioned that the flu virus mutates, and the vaccine, of course, has to change every year. As I understand it, this year it's going to fight 4 different types of flu virus, but you never know, right? Is it still hit and miss, or are we getting better with flu vaccines? We got the COVID vaccine right, didn't we?
Yeah, we developed the influenza vaccine in a different way, and it takes up to 6 months to actually get that production ready so that it can be, rolled out to people. And so sometimes there is a bit of a change in what actually is circulating by the time, we're able to immunize people and we get into the influenza season. So there's always a little bit of a possibility that there'll be some mismatches, or it won't be the greatest match to what's circulating. One of the positive things that may come out of this pandemic is, if we've been seeing so little influenza circulating over the last 20 months worldwide, the possibility of it shifting dramatically, the viruses that are circulating, might be reduced. So, in all hopes, what we are able to offer for influenza vaccines will be, reasonable matches for what will be circulating.
What do you say to people who perhaps have not had their COVID vaccine, or maybe they've only had one shot, and then they're thinking, well, do I get the flu shot or do I get COVID shot number 2? Is it safe to get them both?
Yeah, why choose? You can get both of those shots, and you can get them at the same time if that's more convenient for you, or the only way that you can do it. The original recommendation was separate out your COVID-19 vaccine from other vaccines by a couple of weeks, or up to a month after you've gotten your COVID-19. Just wait until you get another vaccine. And the real reason was precautionary. It was to make sure that we had good monitoring and capturing the side effects and adverse events from the COVID-19 vaccines, because they were newer. Now we have lots of experience with them. We see that they're safe, and we've had some co-administration, as we put it, of vaccines, the COVID-19 vaccine and other vaccines, over the course of the time that we've been giving it to people. So it is perfectly safe to get the two together. Just expect that you're going to get some side effects, and takes the time off that you need to recover accordingly.
Final question for you. Considering that, that we've been talking about our healthcare systems across the country, various provinces being overwhelmed, are you concerned about that maybe we get that double whammy this season?
Oh, yes, absolutely. That's a concern. And that's the thing is this pandemic is far from over. You know, we're still going to potentially see some waves of COVID-19 activity that come up and down. And, you know, the system has a little less wiggle room or capacity to stretch at this point because it's been going on for so long. So this is why it's so crucial that we try and prevent any of those other impacts from other respiratory viruses as well, to be on top of what we're already having to deal with COVID-19. So getting immunized against both of those viruses, COVID-19 and influenza, is one thing that we can all do to try and keep everything functioning and keep ourselves safe. Speaking
of safety, that's what I wish for you. You be well, be safe. Thanks for your time, Doctor.
And to you too. Goodbye.
Dr. Susie Hota in Toronto. She is a medical director for infection prevention and control at University Health Network.